Now, hair loss has become a common issue for many people in the country, with some even attributing it to baldness, baldness to genetics. However, the perspective is different for Dr. Winnie Maina, a dermatologist and a skin specialist. Join Caroline Kimwele as she takes you through the entire hair transplant process and explores the causes of hair loss among both women and men.
Alopecia areata is a disease that happens when the immune system attacks hair follicles and causes hair loss. Hair follicles are the structures in skin that form hair. While hair can be lost from any part of the body, alopecia areata usually affects the head and face. First and foremost, it is important to understand that hair transplant is a procedure carried out by a surgeon or dermatologist whereby hair is transferred from a part of the scalp with hair, the donor area, to the bald area. Typically, the doctor moves hair from the back or side of the head to the front or top of the scalp where baldness has occurred, as Dr. Winnie explains.
When we do the transplant, we clearly patching in or transplanting the area that the hair has been completely lost, okay? But remember, the area that the genetic thinning has not completely destroyed the hair follicles, these hair follicles are still going through that thinning process. We call it the DHT sensitization, okay? So the hair that we have transplanted is permanent. In this aspect, because it came with its donor dominance characteristics from the side, which does not bald. But we will need to do some maintenance form of treatment for the hair that is already existing.
She explains the steps involved in the entire hair transplant process, which is one of the aesthetic medicine treatment options.
Your donor area is a specific area at the back. The side at the back, I'm sure you've not seen someone bald at the back and the sides. Scientifically, this is a safe zone area where we get the grafts. So we shave clean, because I've seen people ask, can you just get the shaft of the hair that you're shaving and plant it? Of course not, because we are shaving, we are getting the root of the hair follicle, okay? So we shave clean on the donor area that we intend to get the grafts. We numb with some local anesthesia, and once it's completely numb, we just now come in and start harvesting. There's a machine that helps us with that, so that to loosely get the graft off, and then we collect with some instrument. So that takes us around 2 to 3 hours.
But what causes hair loss in both men and women, and is baldness considered a disease?
Baldness, I think that's just a name of what people use, especially in men, because of the hair loss that they get on the top area. But if I look at it from the dermatologist perspective, there's something called alopecia. Alopecia is a general term for hair loss, okay? But then within that alopecia, we have so many causes of hair loss. Upara itself is hair loss, it's alopecia, but then it's caused by something different with another, something else could cause hair loss in another perspective. So that is the aspect of skin, hair, and hair loss that comes in. For men, it's quite aggressive because the pattern hair loss is, we call it androgenetic. It's associated with androgens, and we tend to term the androgens as the male hormones. So for men, becomes quite pronounced, and actually it cleans up, and that is why they call the bald the upara. For women, because of also the hormonal aspect, we are not expecting that women have the same level of androgens as women. They do get that, yes, especially around pre and peri and post menopause, because there are quite a lot of hormonal changes that occur during that time. But for women, you'll find it just as thinning. You'll hardly get them get bald like men, but when you look through the scalp, you can see there is some thinning at the top area. So we hardly go completely bald in women.
Apart from hair transplant, Dr. Winnie explains other forms of hair restoration.
Transplant is surgical. All the other options that we have depend on the presentation. There are scenarios where we need to discuss closure. It's a sad state where we do discuss closure, meaning You have come in, yes, you have gone through extensive hair loss, it's scarring. The only modality that would have given you back your hair is transplant. But again, the disease process that you're going through cannot stand or cannot support hair transplant. So that is one scenario. We just discussed closure. Other restoration methods, I'm sure you've seen things like platelet-rich plasma, you've seen laser, you've seen growth factors coming in, and then there are also topical applications. I'm sure people use a lot of minoxidil out there. So from the topical injections and all that, it depends what the disease is, the point of presentation, and how, and the expectations of what we are intending to achieve.
Aside from hair transplant, Dr. Winnie also offers other cosmetic treatments such as anti-aging treatments, scar management, and skin rejuvenation. Caroline Kimwele for KUTV.